Hello, I'm Shelley Henry, and I'm going to introduce you to Neurolumen. Neurolumen takes the best of three technology and places them in an easy-to-use and administer treatment. Neurolumen has two laser diodes, four LEDs, and electrical stimulation in each wrap. A patient can utilize themselves or they can be used in a clinical setting. There are two types of wraps. The double wrap, which consists of two wraps that are connected with a cord, and a single wrap, which has the electrical stimulation going from pad to pad within one wrap. Each wrap has laser components and LEDs. The lasers are at 808 nanometers. The light-emitting diodes, or LEDs, are at 904 and 680. If you notice, the single wrap has two, the double wrap has four lasers and 8 LEDs. Each wrap also contains electrical stimulation. The double wrap has electrical stimulation pads in each wrap, so the current runs from pad to pad between the wraps. The single pad has the pads connected to each other on one wrap, so they go from pad to pad within one wrap. Gel pads. One of the most frequently asked questions that we have is how do we know when to replace the gel pads? Simple. When the gel pad is no longer sticky, when there is visible debris on the pad, or after 3 months of opening the bag. To replace the gel pads, you simply roll the pad off the wrap and discard. You will place the plain side towards the skin and the grid side toward the wrap. Now let's talk about lasers. What is a laser? Laser is an acronym which stands for Light Amplification by Stimulated Emission of Radiation. Energy is amplified to extremely high intensity by an atomic process called stimulated emission. What is radiation? What does radiation mean when you are speaking of lasers? Radiation is often misinterpreted since it is also used to describe radioactive materials and ionized radiation. The use of the word radiation in terms of laser light is merely an expression of energy transmission. For instance, light radiates. The color of laser light is normally expressed in terms of the laser's wavelength, or nanometer. nm is the most common unit used. A nanometer is just a small measurement of a meter, like a millimeter and centimeter, but it's called a nanometer. Laser light is non-ionizing and ranges from the ultraviolet, 100 to 400 nanometers, visible, 400 to 700 nanometers, and the infrared, 700 to 1000 nanometers. Our laser light is in the red part of the spectrum of electromagnetic radiation. Red light has the longest wavelength and provides the greatest depth of penetration. Laser light is coherent, travels in a straight line with waves stacked on top of each other. It's monochromatic, single color, single wavelength, and polarized, concentrated beam in a defined direction. Red and near infrared light increase nitric oxide, vasodilator effect to increase microcirculation. It has an effect on the mitochondria, which increases ATP, ROS, and NO. Its growth factor production, extracellular matrix disposition, and cell proliferation. These properties allows laser light to penetrate the surface of the skin with no damage to the skin and no known side effects. Laser light directs biostimulative light energy to the body's cells, which the cells then convert into chemical energy to promote natural healing and pain relief. Low-level laser therapy, LLT, or cold laser, utilizes a series of processes and chain reactions to produce a complex set of physiological interactions. Laser light stimulates the human cells and triggers a response in the body that has the result of neuron stimulus, decreased inflammation, and increased circulation. As you can see from this diagram, photons, which are the little powerhouses of energy that are produced by the laser, are absorbed, singlet oxygen production, formation of proton gradients over cell membrane and across membranes of the mitochondria, and the very last thing, it causes a cascading effect that increases ATP production, DNA, and changes cells' permeability. There is an optical window within the body where the light is absorbed and used for healing. There are two types of medical lasers. High-powered lasers are used to cut, coagulate, and evaporate tissue. The energy range for the surgical lasers is usually between 3,000 and 10,000 milliwatts, or it can be a highly focused beam. Low-powered lasers, cold lasers, low-level lasers are used to stimulate tissue repair through a process of biostimulation. Lasers are regulated through the Center for Devices and Radiological Health, a division of the FDA. The laser classes help group lasers by their hazard potential and identifies these classes based on their optical emission, wavelength, exposure time, and output power. The FDA regulates the uses of lasers. The FDA stipulates that laser treatments be provided under the oversight of a licensed provider. States determine who they deem to be licensed providers. Electrical stimulation has been used for centuries in pain control. Patients' wearable units were patented in 1974. They are non-invasive, low-risk nerve stimulation intended for use in acute and chronic pain of neuromuscular origin. Electrical stimulation. Mechanism of action. Activation of central and spinal opioid receptors. It stimulates release of inhibitory neurotransmitters. It activates receptors centrally, in effect temporarily blocking the pain gateway. Contraindications. While there are no known side effects from the use of lasers or electrical stimulation, on rare occasions temporary redness, a tingling sensation, or mild pain may occur during or after treatment. These effects normally disappear quickly, usually 1 to 3 hours after treatment. When utilizing the Neurolumen, make sure to remember a disorder called referred pain. It simply means that the pain may be caused from an injury or swelling in another area of the body. Make sure if the patient is not making progress that you treat the spinal column associated with that area. Neurolumen and use with other modalities. Make sure when you're preparing the patient that you just degrease or cleanse the skin with water or a cleansing substance. Make sure the patient is comfortable, and treatment must be given directly to skin. If your patient is suffering from lower extremity swelling, lightly treat the most painful area first to give some pain relief. Using Ashiro's proximity priority principle, treat proximal injury sites for drainage first to open the pathways, then the distal injury last. If the distal injury is treated completely first, lymph can accumulate and pain can increase. Strain injuries. Find out how the strain happened and help them make changes so the injury does not happen again. Treat the pain in the order it arose. Sports injury. Treat as soon as possible. It should take a fourth to a half of the normal healing time. Athlete will want to return to the game, but should return to training slowly. Pain relief is only the first sign of healing, and treatment should continue. On sports injuries, if there are several injuries, use the Ashiro's proximal priority principle. This means to treat the proximal injury first, then distal. If you're treating fibromyalgia, some patients, if you start too quickly with too much energy, can experience more pain. So, read the following and follow the directions. For fibromyalgia, days 1, 5 minutes per point, no electrical stimulation. If no increase in pain after day 1, days 2 or more, 30 minutes with electrical stimulation. If increase in pain occurs on day 1, day 2, 5 minutes per point, no electrical stimulation. If pain increases after this treatment, remain at this treatment level until pain decreases. Headache or migraine. Treat the point of pain first, following the path of pain, by wrapping around the head. Treat the base of the skull and the shoulders and neck. Do not use electrical stimulation. For arthritis, treat the joint directly, front and back, by wrapping or sandwiching the joint between two wraps. If pain increases after the first treatment, decrease treatment time to 15 minutes. Treatment recommendations. Pain therapies will be performed at a minimum of 3 times a week. Circulatory issues need to be treated every day for 2 weeks, then decreased to every other day once change is noticed. I hope this has been helpful. These are simply guidelines to be used in your clinic. Ultimately, you will know what is best for your patient. There are a diverse number of therapies listed that Neurolumen has been effective at treating. If you have any questions regarding a treatment not covered, please call your representative. We look forward to hearing about your experiences with Neurolumen.